Hello, we have another topic of DH exam, which is observational studies, and this is very important topic as 3 to 4 MCQs will come from this topic, and it is very important for you to understand this topic. There are several subtopics in this major topic like cross-sectional study, uh, case series, cohort studies, in which we will study prospective and uh, further different topics. So let's see what is cross-sectional study. Basically, the easiest definition of cross-sectional study. First of all, let me tell you that these observational studies are used in research. When someone do research studies, then he follow one of the following study according to type of research. So cross-sectional study, in this study you have to follow this definition. You have to just sit and watch. You don't have to interfere. For example, there are some children playing in the ground. You are sitting under a tree and you are observing them, what they are doing. If they are running fast, they can fall down. Okay. The other example is a study located a group of subjects with lymphoma, a group of persons, subjects mean persons, they got lymphoma, a disease, and want to identify which subjects are smokers and which are not. So the basically researcher want to know that, for example, he has a group of 5 or 10 people. Okay, the 10 people got lymphoma, and he want to know that from those 10 people who is smoker and who is not. So he is not basically interfering, he is just observing. So he will observe that who is smoking all the day, who don't smoke for a week. Okay. The next example is a group of parents with diabetes, patients with diabetes. This is basically patient with diabetes were interviewed to determine they are currently eating fast food or not. So basically he is linking one thing with the other. For example, if the color of a person is black, he will just observe that either he walks in sunlight or not, okay, or it is natural. So basically he is observing. So in this case he is observing that this diabetes is either by eating fast food or not. Okay. The last example is, which of the following study design is the best to use to access the awareness on the usage of vitamin D supplement? So it is the cross sectional, because in this you have to observe only. You will observe that who will use vitamin D supplement. So in cross sectional study, you just sit and watch and don't interfere. This is the easiest definition of cross sectional study. Okay, we have another topic of observational study, the case series. This one, the case series. Okay, from the definition case and series. Okay, you have to examine similar cases. You have to see one case, second case, third case, fourth case, fifth case, sixth case. All the cases will be based on a single root. Like all the cases are of diabetes, all the cases are of antihypertensive medicines, all the cases are of lipidemic drugs. So the basic root will be the same of all the cases. Okay. For example, I studied a case of TB of a patient Mariam. And then I studied another case of TB of 79-year-old John. So Mariam was 5-year-old and John was 79-year-old. Okay, so basic root was TB, but there is age difference. So I want to know more about TB in different ages. So basically you have to study similar thing to know more knowledge about that. Okay, let's see the example. This is very famous example. It comes in exam as it is, like you can remember this by TB. Okay, GIT TB. So where you get GIT TB in exam, this is case series. The author report two isolated two. Basically he is saying two. Okay, two isolated cases of GIT TB in renal transplant recipients. Okay, that illustrates that the difficulty of making this diagnosis and a brief review of the literature on its clinical presentation. Diagnosis and therapeutic approach. What is the type of study? So he's basically using literature and different things to know more about that, to know more about GIT TB in renal transplant recipients. So if you get something like that, the answer will be case series. Very easy. Okay, we have a third topic of observational studies, that is case control. So from this control you can remember the definition. Basically in case control you have to be detective, you have to find something, you have to be detective, you have to be silent and find something. So from control you can say that a detective in a city wants to know about the cause of crime. So he want to control the crime rate in that city. So from detective you can remember control. Okay, case control means detective. Researchers compare a group of people who have diabetes. There is a group of people like 10 people, 15 people who has diabetes mellitus. Okay, and looks back in time to see characteristics of two groups differ. Which of the following uh, is the described study design? Okay, first of all, a people who have diabetes with the people who have no diabetes. There are two groups. Let's suppose 10 people with no diabetes, 10 people with diabetes. There are two different groups. Okay, and looks back in time to see characteristics of the two groups differ. Which of the following? So he wants to know that these two groups have got diabetes mellitus. One group have got diabetes mellitus, other don't have diabetes mellitus. He want to know the cause, so he can make better ways. He can control the bad habits by which they got diabetes. So he is detective in this case. Okay, or you can say that he is comparing the similar disease with the person who is not getting. There is one question here that in cross-sectional studies we also got that person who are eating fast food are getting diabetes, but there we were not comparing diabetes with diabetes, or persons with persons, one with diabetes, other with no diabetes. We were comparing persons eating fast food and getting diabetes. We knew the cause of diabetes, the fast food. In this case we don't know the cause, so in this case we are detective. Very easy. Okay, now we will study about systematic review. Review means you are studying different studies. Okay, from review you can make a hint that you are reading different newspapers, you are reading different books, you are reading different notes, you are reading different tutorials and different things on internet, okay, on hypertension. So the basic thing is, there is one topic on which you are reading different materials to get the information all together. So in systematic review, you put many studies all together. Which of the following is the type of studies considers data from multiple studies of different designs to draw conclusion? So you need to get to draw conclusion. For example, you want to know that hypertension, what is the cause of hypertension, major cause of hypertension? Either it is obesity, either it is smoking, either it is fast food, either it is immobility. So you will study different cases, you will study different books, and then you will draw conclusion. So this type of study is systematic review. Okay, now we will study about random clinical trials. So in this, by definition, when we see the definition, uh, there is, or you can say that in this, you are a scientist, okay? You are a scientist and you want to do some experiment. You have some medicines for hypertension and you want to try these medicines on different groups. Like there are two groups and you want to try the medicine on two groups to know the potency, to know the efficacy, uh, and other things, okay, half-life, etc. So you are doing random clinical trial, test new ideas by giving groups random medicines, okay. Like in to one group, on first day you gave a medicine like propranolol, okay, antihypertensive, and other day you gave placebo. You know what is placebo? Placebo are basically inert substance. They don't have any medicine in it, they don't have anything in it, but patient don't know that this is a fake drug, this is not a drug or medicine, this is nothing in actual. So when he eats, psychologically he thinks that he has taken medicine, and sometimes results have shown that after taking placebo, the result was same with medicine, because this is done to check the psychology of patient, okay. So in random clinical trials, you test new ideas and you are scientist. Okay, one of the most important topic is cohort studies. What are cohort studies? Cohort studies can be divided into two types, retrospective and prospective. So basically, what is the meaning of cohort? Cohort means what happens over time, with the passage of time. For example, if you give a cigarette to your friend, a packet of cigarette to your friend, and you ask him to smoke them on daily basis for 3 months. Okay, he is now smoking cigarettes for 3 months, and with the passage of time, over and over, you will check what changes are being done in him. Like the lips are getting black, he is coughing, he is getting some heart problem. So with the passage of time, after 1 month, 2 month, 3 month, you get conclusion and you know the results. You get the results. Okay. So cohort means with the passage of time. So there are two type of cohort studies, retrospective and prospective. In retro mean past, what has done in past, what has done in past. Like a person got hypertension, you will check the past history of the patient that he was doing smoking from past 10 years, okay. Now in prospective means in future, he has started smoking today, what will happen after 5 years, okay. So past and future. So from past, you can identify if a MCQs comes with which of the study? Recall bias. So recall, from recall you should understand it is retrospective, past. And the other one is the example of prospective. If a study is to follow a group of smokers and a group of non-smokers, time, here he has mentioned time, and see which one develop lymphoma. Okay, develop means with the passage of time. So this is the example of prospective, very easy. Okay, there are several terms you have to remember to identify the case studies. Like in cohort studies, you have to know there is a risk, or for risk studies you will use cohort studies, past and future. You will check the past and future. For case control, you use this study design for rare diseases. Okay, you have to be detective like control I told you earlier, and you use this case study for rare diseases. And RTC, random control trial, this basically is expensive because you do some experiment, you use medicine on groups. And intervention, so these two terms are for RTC. Systemic review, this study design is used to identify side effects of drugs. Okay, so these are very important.